which again isn't unexpected considering the case volumes that occurred. We have put in greater restrictions as well right now. So we put in lots of more restrictions on Manitobans, especially in Winnipeg and let's say in Brandon area with the closure of schools to, reduce those transmission chains that are occurring in the community to limit that community spread. We should see a plateauing and a leveling off of these numbers. But that will only occur if people adhere to the orders and adhere to the messaging. So I think that's the important message here is we're asking people to do something. We've asked all along, and what we're seeing here is the non-compliance to that, which is driving this up. So as you can see, our system is being strained. We've put in greater measures, and now we're asking again. The acute care my physician colleagues in ICU and emergency rooms right across the province are asking, public health is asking for Manitobans to limit those interactions, to adhere to the orders. Don't do anything unless you have to do something.
And putting all these slides together, I'm wondering if you can boil it down and answer the following. I understand it might be a ballpark figure, not an exact number, but at what number is the intensive care unit usage expected to peak, and at what number is the daily case count expected to peak, and roughly when are those peaks expected to occur?
It's a tough question to answer. I mean, this is about people adhering. So if people follow the order, follow the spirit of the order, follow the messaging, I think our case counts will likely increase over the next 1 week's time. We've already seen that increase since the orders have been in place. Hospitalizations and ICU capacity, there's a bit of a lag time there as well. So it would probably take 2 to 4 weeks before we start peaking in those areas as well. And it all depends on when Manitobans started to adhere to the orders. Did they start to adhere when our orders first changed on, April 20th or 28th, or what percentage? Or is it going to be the May 7th order change where a greater percentage of Manitobans are adhering to the orders and the messaging? That plays a role in interactions and plays a role in risk on case generation, and again, hospitalizations and ICUs. Since April 23rd, our case numbers on a trailing 7-day average have increased 33% per week. Our hospitalizations have increased roughly 18% per week, and our ICU admissions have increased roughly, about 20% per week. So I would anticipate, in a week, if these percentages hold up and they peak, and we think that plateau is going to happen and Manitobans adhere, and they limit those interactions, probably we're going to see, 18% more Manitobans in hospital next week and the following week thereafterwards before we get that peak, before that number starts to come down. So again, it is imperative, I think, that Manitobans really listen to the message, really try not to skirt around the orders, follow the spirit of the orders. And many Manitobans already do. We acknowledge that, but there are others who aren't. And I think we all know some people in our own lives that aren't, or if they have, they've just started to. Let's encourage our friends, let's encourage our neighbors, our community members to adhere to the orders and follow the spirit of the order and limit those interactions.
From CTV Winnipeg, Michelle.
Hi, Dr. Atwal. I'm wondering if you could talk a little bit about best case scenarios, and where does the model take into account the impact of a larger portion of the province getting vaccinated?
So the model takes into account vaccinations and takes into account uptake of vaccinations and sort of immunity developing 2 weeks thereafterwards. There's roughly 250 variables in the model. The important thing here, again, this is all about behavior and behavior change. Best case scenario, people do what's asked of them. We're going to have a peak of cases in a week, a peak of hospitalizations, ICUs, in admissions in 2 weeks' time. Then we're going to see that drop-off happen. That is the best case scenario, and that's what we're hoping for. This is what we want Manitobans to understand. The vaccinations, within 2 weeks' time, we're going to have another probably close to 200,000 people vaccinated. That's important, but just because you get the vaccine in your arm today doesn't mean you've developed immunity. It takes 14 days to develop immunity, and even at the 14-day mark, it's not 100% immunity. About 80%, depending on the vaccine, 85% will have immunity developed at that point, but there's still that other 15%. So again, best case scenario, adhere, limit those interactions. We're going to see some rises in case numbers on an average. We're going to see some rise in daily hospitalizations, total hospitalizations, daily ICUs, total in ICU for a couple of weeks' time, and then we should see that taper down there afterwards.
Thank you. Dr. Reimer, with the youth announcement today for vaccinations, does this change at all plans for second doses? We've talked about previously that as soon as you drop to 12, the next day, second doses could be started to be booked, and that day is May 22nd. Are you still sticking with that?
So May 22nd was the date that our logistics team told us we would be able to open up to second dose, like no later than that date. And so now that we're able to reach youth sooner, I anticipate we could be opening up to second doses sooner than we originally projected. But I also have heard that there's been a lot of uptake today and a lot of appointments booked. So I think we're going to need to give a little bit of time since this cohort appears to be booking quite rapidly. We'll need to give them a little bit more time to book in before we're able to open up to second doses, but nothing so far has told us that we would be going later than the 22nd, and it will likely be earlier.
From CityNews, Stephanie.
Hi there, Stephanie Wolfsuk from CityNews. Just wondering, as we look at some of these projections and thinking about schools, it was said earlier that we don't know after the current restrictions if students will get back into schools, but these numbers are pretty alarming for that June month. Is it safe to say that it might be a little bit implausible now that students would be going back to school? When you look at these graphs, what can you tell parents, I guess?
Yeah, I mean, we're working with education on a regular basis in relation to schools. And again, we didn't put schools on remote learning because we were worried about transmission at schools. It had to do with community transmission and what was happening outside of that school setting. So we're going to continue to look at our data. Obviously, a lot of our newer cases are in that younger population, and we're seeing a lot more of that shift between older individuals to younger individuals over the past few weeks who are getting infected as well. So I think it's too early to discuss that. I think from a public health perspective, we recognize and the importance of education, the importance of being in school, and we really strive, we really tried not to close schools in Winnipeg and Brandon. You know, we knew it was very important for families, for students, for a number of reasons, and it was because we had so much community transmission, we had to go down that road. So the intent here is to try to get kids back in school, but it is hard to predict out, 2.5 weeks from now. So we're going to have to take this day by day, week by week, and look at that information that we have, and hopefully we see a reduction in community transmission, and then I think that will really allow us to bring students back.
Thank you for that. And then just looking at these graphs, some of these peaks coming in a bit later in the summer, what kind of hope can you provide to Manitobans that they might be able to see their loved ones this summer?
Again, this comes down to behaviors, right? So when we look at summer, the path that we're going down right now means a lot of cases are being generated. Summertime, we're still, technically about 6 weeks away or 7 weeks away from, the beginning of July. There's going to be vaccine available for basically anyone who wants vaccine. We're going to be into, the second dose for a lot of individuals as well. That's going to provide a lot of relief from a case generation perspective, from a hospitalization perspective, from an ICU perspective. We need Manitobans. If we want a good summer, do we want to be able to get back to those things we love? Do we want to be able to gather with our families, have a barbecue, have people over, enjoy the outdoors? We need Manitobans to sign up for that vaccine, and we need them to sign up now. We need them to sign up for the second dose when it comes up. So really go out there when, again, it's everyone's opportunity now to get that vaccine, sign up for that vaccine, and that vaccine is what's going to allow us, a good uptake of vaccine, a high uptake of vaccine is going to allow Manitobans to get back to summer the way they remember summer being.
From the Winnipeg Free Press, Katie.
Good afternoon, Dr. Atwal. You've said that the virus is mainly spreading because people aren't following the orders. They're having household gatherings. But we have no information on the cause of exposure in almost half of all cases in Manitoba. Before we saw this modeling, the most recent provincial data that we had from earlier this month showed 23% of cases had unknown transmission, and 21% of cases were still pending contact tracing. So what is the risk of community transmission in the province right now?
Well, we're seeing lots of community transmission. We see a lot of transmission chains out there. You know, when we talk to some cases, they are withholding some information. So we have lots of evidence of that. You know, we have people who are being honest, who are saying, yes, I went to a bonfire. Yes, I had a sleepover. Yes, we, 6 of us got together at someone's house and played video games, right? Yes, we had a big barbecue. We have a lot of that information as well. So we know that community transmission is happening. This virus, it's about interactions. If you don't interact with anyone, you're not going to get the virus. Once you interact with one person, you have to look at all those other people that person interacted with to look at your risk as well, right? So the risk is there with interactions, and that's why we're asking Manitobans to limit those interactions. That's the most important way to plateau and to really bring down our case numbers, to plateau those cases, which will have a tremendous impact on our acute care system. And as more vaccine rolls out, it allows us to get back to potentially some of those things that we want to do sooner rather than later.
Okay, and related to Michelle's question, for Dr. Reimer, considering the current rates of vaccination as well as the current rates of virus transmission, how long is it going to take to see the benefits of vaccine coverage in Manitoba, even with just one dose?
Well, we've already started to see benefits in some populations. So in northern Manitoba, we're seeing the effect of the third wave has been dramatically lower than the rest of the province. We've also seen huge differences in the risks in personal care homes. We were reporting many outbreaks going on at the same time and deaths every single day in personal care homes. And now it's a rare circumstance to have an outbreak in a personal care home. So we know that this vaccine, even with one dose, is already providing some relief in some places, and our numbers would be higher without it. What we anticipate is that when we're going to see the biggest impact on the overall wave is when we hit that 70% mark. But I do also expect that as we're getting above 50% of adults, which we'll be doing probably by tomorrow, that we're going to start to see some improvements. The model takes that into account. And so we're trying to balance what we know about the vaccines coming in with the delay in the immune system response, with the existing transmission patterns that we're seeing in the province.
From Global News, Marnie.
Hello, Dr. Reimer. Second doses, it sounds like they could be starting pretty soon. Is there a plan in place for where and how people can get proof of vaccination once they've received that second dose?
So you can already get proof of your vaccine on our online portal. So if you have a health card number, you can sign in and then you can see what vaccine you received and the date you received it. And so people can print that off as a record of their vaccine. For those who don't have internet access or don't have a health card, you can also call your local public health office and they can print off your vaccine results for you so that you have that as well.
And for Dr. Atwal, you mentioned younger patients. Obviously, we're seeing them in hospital for longer periods of time than older patients. Can you just provide reasoning behind that?
We have variants of concern out there. They're more communicable. We've known from international studies, some of them, increase your length and stay in hospitals or in ICU admissions as well. So again, we have seen because of vaccinations, the way we rolled out vaccinations, we protected those oldest first. And that's where we've seen that shift in hospitalizations over the past few weeks, where, you know, a month or two ago, the majority of our patients who got admitted to the hospital were over 50. You know, now we're seeing it less than 50. And a third of them are in their 20s, a third are in their 30s, and a third are in their 40s. The majority of the patients who have been admitted, even those in their 50s, 60s, and 70s, the last few weeks have been unvaccinated. There are some exceptions there, but for you know, the way the vaccine works, it's really effective, it seems, from other studies from outside of Canada. You know, even with our local learnings here in relation to vaccine, we're not seeing vaccinated individuals come into hospital. So younger individuals, there are some perfectly healthy younger individuals who had to be admitted. You know, we have a couple of younger individuals in ICU for sure, under 20. So it is a bit different of a virus and how it spreads, how it's communicable, but also its impact on one's respiratory and cardiovascular system, one's immune response to it, which is perpetuating some extra admissions. So, you know, we are seeing that shift. Again, some of these younger people have some underlying health conditions like diabetes or like high blood pressure. Again, some are perfectly healthy, and some are, you know, the biggest risk factor they had was like about 15 pounds of extra weight. So all those things play a role in risk. And we are seeing that dramatic shift now into younger populations being admitted. So roughly over 7 days, we had roughly 140 admissions to hospital for COVID-19. You know, 70 of those were 50 and under. So it's a big number. And just because you're young, you can't think that, you know, it's not going to impact you. It can impact you, and you could have a severe outcome.
From the Brandon Sun, Kim.
Good afternoon. We're hearing from at least one personal care home that there are at least 12 nurses who are refusing the vaccine. So what I'm asking is, what do you say to the families who are fully vaccinated, living in a bubble, but unable to see their loved ones due to the restrictions, where there are nurses on staff that are actually refusing to receive the vaccine?
Yeah, that's, I don't know about this particular scenario. I mean, what we've always done is encouraged individuals, talked about the risks and the benefits related to the vaccine. We put a lot in place to make it easy for individuals to get vaccine. There might be some vaccine hesitancy out there, and, you know, we've, on an ongoing basis, worked with those who are hesitant. And we're going to continue to do so as well. We're operationalizing a lot more on the vaccine side as well in relation to working with groups regarding vaccine hesitancy. Again, you know, it's good if you are hesitant to have that discussion with your primary care provider, have that discussion about with a public health individual as well in relation to your vaccine hesitancy. Get really good information on that to make really good decisions, not only to protect yourself, but to protect your family, your community as well.
Thank you for that. My second question is, you mentioned enforcement is increasing. I just want to touch base on that and just say, how is the collection of fines going? We're seeing the increase in the numbers of enforcement, but, you know, are we actually doing anything? Are we actually accomplishing collection of the fines?
Yeah, I'm not on the enforcement side, so I know enforcement is out there. I know they are ticketing. I know fines are being collected. I think, you know, asking that question to the justice side directly might provide you the best answer to that.
From CJOB, Skylar.
Thank you, Dr. Atwal and Dr. Reimer, for your time this afternoon. Dr. Atwal, you said that you and your colleagues have been looking at modeling for some time. We, you know, at our outlet and other outlets across the province have been asking for that modeling for some time. You also asked Manitobans to adhere to the spirit of the order. And quite frankly, I find these models today quite depressing. I'm wondering, would there have been a greater adherence to orders if this modeling was released 2-3 weeks ago, instead of asking Manitobans to stick to the spirit of the order? You could have given them some concrete reason why they should.
Yeah, it's challenging. I mean, every time you develop a model, it might look a little different as well. You know, we have looked at models. I think in the future we are going to be providing more modeling information that will be publicly available and presented to the public on a more regular basis as well. You know, I think we've gone through experiences already with Wave 2, you know, in relation to what to expect what we're asking Manitobans to do. I mean, this is in all of our hands, right? It's up to us to change those behaviors. Perhaps for some, maybe if they saw a model earlier, it would change that behavior. Obviously we spoke to it, we stressed the importance of it. We had acute care colleagues talking and discussing and showing how busy the hospitals are as well. So it is challenging to say, maybe it would have helped in some situations, and in other situations it probably wouldn't have made a difference either. I mean, when someone is asking, when we have laws in place to say don't do X, Y, or Z, people need to adhere to that. And that really is impactful if they don't, and that's what we're seeing right now. So again, on an ongoing basis, we are looking at providing a model on a more regular basis, and we'll work with our group to provide that to the public.
Thank you for that answer. You talked about enforcement this weekend. If there are, in fact, anti-mask or anti-lockdown rallies, I think a lot of Manitobans are trying to do the right thing and they are limiting their contacts, but it becomes very hard for them to adhere to those orders when very public instances of people flouting these orders are, present on the weekends or at any point. So is the province going to make sure that if these gatherings occur, the message is sent on the spot and not afterwards with retroactive fines, which have less effect when it comes to getting Manitobans to, adhere to the message?
Yeah, so my understanding is, and I know that enforcement has been much more visible over the past few weeks, they are ticketing a lot more as well. They will continue to do so at any gathering that's occurring. So different municipalities, the province, a lot of individuals will be out there looking for those who are breaking the rules, and enforcement will prevail at any one of those interactions as well. And I think any further details, again, I think would have to go to Justice to answer some of the specifics that you're asking about.
From the Winnipeg Sun, Scott.
Hi, good afternoon, you both. Dr. Atwal, you're saying here that, essentially that messaging, people need to adhere to it, but it sounds that, it seems obvious that, there are some still not doing that, or maybe even more than some. And then you've also kind of alluded to the fact that modeling may have changed some behaviors, but not all of them. So what is the solution then to, you can increase messaging, but does the messaging have to change? What needs to change to get people on board?
So, we've changed the orders. We made it a lot more restrictive, made it really inconvenient for people to kind of get together. A lot of Manitobans are adhering, plain and simple. I acknowledge that. I think we all acknowledge that. There's some who just don't adhere at all. And there's others who are in general adhering, but they do at times, not adhere, make their own little risk assessment. Oh, I think it's going to be okay for me to go to my neighbor's house because our kids play at school together. That poses risk. For those who are partaking in those activities, and I think we've seen a shift in that as well, where now those individuals are becoming a lot more restrict and really adhering to those orders as well. So they're less hesitant not to. There's more buy-in there. So I think as our case numbers increase, as people saw that impact on the acute care system, as we continue to message out from a public health perspective on risk, I think it's clicking in a little bit, and people are more adherent, and everyone does have a lax moment, or they judge something to be low risk, or it's right on the fence of an order, but they'll do it. And I think from the public's perspective, they just need to really limit all those interactions, right? Limit your interactions unless you absolutely have to. And we're working on messaging. We've always messaged through the pandemic. We always want the least amount of restrictions on Manitobans. If we want to lift restrictions sooner rather than later, we have to do something now. Everyone has to do something now. So really limit those interactions. Otherwise, there's a chance that, cases continue to rise. Acute care capacity continues to climb, and we're going to be in this for a lot longer. And you can look at our neighbors to the east, and they're running into trouble still, and they're going to continue to do so for a number of weeks, right? So do we want that to happen to Manitoba? Or do we want to just really, do what we can right now, really stop those interactions, really cut those transmission chains? If you're sick, go get tested. have your family self-isolate at home with you until you get that test result back. Fully participate with public health in those investigations. That's what we need Manitobans to do.
Thanks for that. On a different note, the CDC yesterday, I believe it was yesterday, made the announcement that people fully vaccinated would, cease to have to wearing masks in most public places. Is that something that Manitobans can look forward to once fully vaccinated, or is that something that province will be more hesitant on than our neighbors down south?
Yeah, so that's about the future here, right? We're just opened up vaccinations for the first dose for those 12 and up in Manitoba. I mean, obviously getting that second dose is going to take some time. We'll probably be sometime in July where most Manitobans will be able to get that second dose. Again, we don't want restrictions on Manitobans, barring vaccine escape, barring some other unintended issue, with enough Manitobans who are vaccinated, who have 2 doses of a vaccine. I think there's a lot that we're going to be able to do from a public health perspective. And not having a mask on would be one of those things. Obviously, we're not there right now. And what you're talking about is many weeks down the road, but that is very much on the table.
From CBC Radio Canada, Alexia.
Good afternoon to the both of you. Do any of you know how many vaccine appointments are booked in total as of today, and how many Manitobans are you projecting to vaccinate by June 9th?
So I don't have those numbers in front of me. We can take that back and ask our scheduling team if they have that available. But by June 9th, we should be able to have a first dose in the arm of all adults who want a first dose. With the week after that, we should be at everybody who's 12 and over getting a first dose. Now, of course, the way people book, it may not perfectly align with age cohorts getting their first dose in order. But those are the estimates that we have been working with based on what we're hearing from the federal government about how much supply we can expect to get.
Thank you for that. I was also wondering about your opinion on the overall ID of the post-lockdown Ottawa just released, which says, for example, that we could reopen terraces in the summer and reauthorize concerts the coming autumn. So what do the both of you think about the timeline they provided? Is it realistic?
Sorry, is that the timeline from who?
From Santé Canada.
So we are presently working on a strategy on how we would look at Manitoba's reopening. Again, we're looking at the information, and nothing is finalized at this point. So we are looking at something, and when something does become finalized, we will provide that to the public.
Our final reporter this afternoon from CBC Manitoba, Bart.
Hi, Dr. Atwal. Just going back to Steve's original question, on what date was your scenario range generated in this model?
I'd have to go back and get that information for you, Bart. I don't have the date.
But you don't want to make this a second question, but it was prior to mid-April, I'm assuming. Could you, to the best of your ability, given the trajectory that we see now exceeding our worst-case scenarios, based on everything you know right now, what do you think is the best and worst for case counts, hospital numbers, and ICU numbers at the peak of this in the next couple of weeks?
Yeah, so I think this was answered a little bit earlier, Bart. So again, if we get really good adherence to the orders right now, I think our case numbers will probably peak in a week or maybe just afterwards. Our hospitalizations and ICU numbers will still continue to climb, probably 2 weeks down the road, maybe even 3. This is all dependent on adherence and how people adhere and how they adhere not only to the orders, but also about the messaging about getting tested, about self-isolating and waiting for that test result, about limiting those interactions and doing only what's absolutely necessary. So a best case scenario is, within a week we got a plateau. ICU numbers come down 2 to 3 weeks, peaking in 2 weeks with hospitalizations, or 3 weeks, and then trending down there afterwards. Now, obviously, if there is no adherence, we will go down not a very good path. But we are hoping and we are expecting Manitobans to adhere so that our numbers plateau and we limit the impacts on our acute care system.
Doctor, I asked numbers, not when. I asked the actual number.
The actual number. So, in the last, since April 23rd, I mentioned this earlier as well, sorry, the case numbers have increased by about 33% per week. The ICU numbers have increased by about 20% per week, and the hospitalization numbers have increased by about 18% per week. If we're thinking that the cases are going to peak probably next week, that might be another handful of percentage points going up. The hospitalization numbers I would anticipate going up probably by about 18 to 20% next week, as well as the ICU numbers, and probably a little bit higher there afterwards the week after before they start to trend down.
Thanks, everyone. This concludes our media briefing.